too, but to tell us more about what's happening as we open up the country. And I think everything's open up besides the borders now and the schools. We have Dr. Erica Wheeler, PAHO and WHO country representative for Trinidad and Tobago and the Dutch Kingdom Islands, who continues to provide us with relevant information. Good morning, Dr. Wheeler.
Good morning, Lisa. Happy to be with you this morning.
Oh, always, as always. We continue the conversation surrounding the reopening of our economy and the country. And as of today, we said it before, bars, beaches, gyms, cinemas, and a whole lot more dining, restaurant services, and so on. What can you tell us about this stage?
Okay, so this stage we are at now signals the reopening is based on a combination of two things that the government needs to balance: the scientific information as well as the real life situation in the country. So on the side of the scientific information, um, the periods of 14 days, and in some cases maybe less than 14 days, have been used as the basis of the phases. But this has been done in combination with community-based testing. I understand from the chief medical officer that they've chosen a health center and they've been doing community-based tests. They have not found any COVID-19 at the community level. At the level of the public health services, it's under control because the only clients in the service now are the 6 persons who tested positive from the cruise ship, and they are now in hospital. So at this stage, we have no threat of the health service being overwhelmed. We have no new cases that we cannot identify because the 6 cases are clearly identified from the cruise ship. So I believe this is because the government is reasonably confident that there is no community spread, and the World Health Organization has certainly not classified Trinidad and Tobago as having community spread, but what we call sporadic cases.
Yeah, but as people
these
start,
are the balancing things that we need.
yeah, but as we start to go out and move around each other in gyms and bars and beaches, and so do we anticipate an increase in numbers, do you think?
In the numbers of COVID-19 cases, you mean?
Yes.
No, we don't anticipate it because our borders are still closed, but you will notice that there are still many public health measures in place. And so it should be for the time being. No country in the world could ever say it is 100% COVID-19 free, because remember, we are still at a stage where we have no treatments as such, although we do say there is a treatment for those who are severely ill,
Yeah.
but there's no prophylactic or nothing which prevents you from contracting COVID-19. There's no vaccine, so you can't take a vaccine to protect yourself. So at this stage, we still need to be observing the public health measures while we open up the economy, because understandably, economies have been under tremendous strain as a result of persons not being able to go to work and industries and businesses closed down. So it must be a balancing act. We can't move forward. You can't open businesses without paying attention to all of the public health and social measures, the physical distancing, continuing the hand washing and everything like that. I do think, however, that if there are elderly people who are ill in the community, we still need to continue to protect such persons because they are more vulnerable.
Yes.
And we must be aware of that we can't just throw caution to the wind, that we do need to still continue to observe our public health measures while we reopen. And then, of course, the government must observe if there are any changes, if there are any hidden COVID-19 cases in the community, which we don't anticipate. But as I said, we need to continue to be cautious.
Dr. Wheeler, I know tomorrow we're going to speak specifically about the Saharan dust, but I need to ask you this because some of the symptoms that persons will exhibit who are affected by the Saharan dust might be similar to the symptoms, the coughing and running eyes and so on. How are we going to treat with that? Because, you're told as soon as you exhibit these sort of symptoms to stay away from work or to stay away from interacting with the public. this is a balancing act on its own as well.
Yes, yes, it is. But you have to remember that it's not that on its own for the Saharan dust. Remember also that fever is one of the key symptoms of COVID-19. And
Right.
if your sinuses are affected by Sahara dust, that does not give you fever. Runny eyes and a runny nose are not exactly typical of COVID-19 either. Although
Right.
we keep discovering things that we don't know, but at this stage, we don't see that as some of the typical symptoms of COVID 19. So
Mhm.
I think we do need to be cautious and not jump to conclusions because you have a runny nose or you're sneezing. And again, sneezing is not exactly a symptom of COVID 19, but certainly if you are suffering from Sahara dust and your sinuses are affected, there's no reason why you should try to go out and about because you clearly have to protect yourself, protect your health.
Yeah.
So it doesn't mean that you need to necessarily rush out there because you are being affected by Sahara dust. Because depending on how it affects your body, you can become, severely affected by sinusitis. So
Hmm.
one needs to be aware of things like that.
Working out in the gyms and having to wear masks. How does that work? Because some persons find it difficult even wearing the mask on just regularly, uh, in terms of
Yes,
breathing. So the exertion of working out and having to wear a mask.
I'm afraid that is indeed a challenge. The World Health Organization does not recommend using masks while doing vigorous exercise. However, if gyms do have their equipment in such a manner that people are sufficiently distant from each other, and remember, good hygiene in a gym should always be that after each person uses a piece of equipment, it is clean. So I think heightened heightened cleanliness in a gym is critically important, as well as persons being a minimum of 3 feet away from each other. So when you have your bicycles and your elliptical trainers and so on,
Mm-hmm.
that they need to be positioned in such a fashion. Now, if there is a gym instructor, that is different because the gym instructor is not working out. The gym instructor should wear a mask in that situation, but it is indeed not recommended by WHO that if you are doing heavy physical exertion, that you wear a mask.
Mhm. I noticed the mention of beaches and rivers, but not swimming pools. Um, do you know, Carrie, if the swimming pools have been open? Dr.
No,
Wheeler,
I
do you know?
haven't heard
I
any
didn't hear anything
information on
about
that.
it. Is there a particular reason? Do you know, Dr. Wheeler?
About swimming pools,
Yes.
except the fact that people do tend to get closer to each other in a swimming pool than they do in the sea. And remember, outdoors, you are at far less risk of spreading COVID 19 in an outdoor situation.
Mm-hmm.
But for a swimming pool, usually you have people coming into closer contact with each other. So unless there are some regulations about how many persons should use a pool at any one time. I'm assuming that out of an abundance of caution, the government is not opening pools now. But
Yeah.
certainly there is greater proximity, as you would know, in a swimming pool compared to if you go to the beach and
Yeah.
you're in the sea.
But
You
that's
are
how I feel
far
about
less
bars as
danger
well.
in. Yeah,
Yeah. That's how I feel about bars as well. I don't know how people are going to physically distance themselves in bars. People tend to want to hang out together, but we'll see.
congregate.
We'll see how that
Yes.
goes. We just have a few more minutes, and I want to talk about the reopening of the country's borders. Given the resurgence of the virus in other parts of the world, what do you think is going to happen with this? I see Australia has said they're not going to open until what, 2021?
Yes. So we have a situation where, as I mentioned earlier, we don't have a treatment for COVID 19, we don't have vaccines. So it is always anticipated, and rightly so, that as soon as you open your borders, there is a very high probability that you will begin to get cases. Some countries are doing so on the basis of what their health systems can cope with, because again, if their economies have been severely affected and they're in danger of their businesses losing so much money and the economy going down, they are trying to open borders in a managed way, but it is a big challenge, and it really depends on your ability of the health system to cope with an influx of cases.
Mm-hmm.
If you open your borders too soon without putting measures in place, as you would have seen, and the number of cases rise to an extent where the health system cannot cope, then you know you're in severe danger. So the issue is, how are the borders opened? When are they opened, and how are they opened? Are they opened in phases? Um, in the case of us in the Caribbean, if we open borders to other Caribbean countries, we have to be very mindful that there are people from other countries that pass through
Yeah.
other Caribbean countries to come into the Caribbean. For example, if you want to come to Trinidad, you can pass through Barbados from England or Canada or somewhere else. So it's a question of the numbers and what measures is the government going to put in place to ensure that it captures those persons coming in. So all these things will have to be thought through by the government before our borders are open, because we are very sure with a high level of probability that as soon as you open borders, you will get cases. So
Yeah.
that again needs to be balanced with how many people come in, at what rate they come in. Will there be a danger of overwhelming the health system as they come in? So I have no information on when borders will be open, but we can certainly expect that there will be cases as long as the borders open.
All right, we're going to have to leave it there. Dr. Erica Wheeler, thank you so much. PAHO and WHO country representative for Trinidad and Tobago and the Dutch Kingdom Islands. We're going to be talking to you tomorrow again about the Saharan dust, so I look forward to that. And be safe today, Dr. Wheeler.
Thank you. You too.
All right. We just have